Good. Well, it's sort of morning, afternoon, 12 noon. So thank you all very much for attending today's local outbreak engagement board. And as a normal reminder, please use the microphone so that we can hear Simon and Simon can hear us, please. I'm just going to go through the agenda, and item 1 on the agenda is the minutes of the previous meeting. Everybody present here was present at that meeting, so could somebody please prove they are true record of what took place? Thank you, Councillor Andre, seconded by Councillor Love. I will just sign the minutes. Give me a long signature. Thank you, Megan. That's lovely. Thank you. So we move on to item 2 on the agenda, which is any declarations of interest. Are there any? None received. Thank you very much. We move on to item number 3, which is public question time. Have we received any questions from members of the public?
None have been received, Chairman.
None received. Nobody in the public gallery. So we move on at a pace. See, I did say don't take your coat off, we won't be long. Okay, so we move on to item number 4A, which is update on the current situation. So Simon, it's over to you. Thank you very much.
Thank you very much, Leader. I will share the presentation. I realise that's quite small on the screen, but I'll use it just as a bit of an aid memoir, and that will be shared later on. So I think that's now on the screen. Just for reminders of you, the data that we go through on a fairly regular basis. If you look at the weekly rates across the country, we can see that we've had a slight increase in the south of England in terms of COVID cases in our part, but it's all a bit of a mixed picture. But we're seeing those rates kind of steadying off across the country. And you can see when we look at the Isle of Wight that our all age detection rates slightly diminished here to 538 hundredths. That's the 7-day rate. Our over 60s rate has increased, and what we're seeing, as I show you some of the age bands, that we've seen it kind of creeping up the ages. So I'll show you that in a minute. And our positivity is higher than we'd like. It's over 12%, and that's due to the cases spreading. And when we look at the PCR testing, we can see we're seeing an increase in testing. So that's really important to note. So it's not that we're having people not testing. That's been constant with in terms of the rate of infection. So that's really good news that people are still testing if they have symptoms. And then lateral flow testing. So that's the asymptomatic testing, a slight decrease, and we have picked that up nationally. That slight change of policy there. Nationally, so we're just working through that to ensure that we can maintain our asymptomatic testing. When we look at infections, you can see the total number of cases, sadly, across the Isle of Wight since the beginning of the pandemic is 15,000, and we've had 766 in the last 7 days, but fairly steady. You can see it kind of just bumps up and down, but a fairly steady rate at the minute. Just reminding colleagues that at the beginning of the pandemic, our testing was different, and we only tested those in hospital, whereas we're testing a lot of people now who aren't in hospital and aren't that unwell. This is the one I really wanted to focus on. We can see we've got a high rate of COVID in our 10 to 14-year-olds, and that's because school age, we've got people mixing in schools, and those are the people who are mixing more, and that's also now creeping up our age band. So we're just watching that. They're the parents of those children and possibly the grandparents. Really important for a couple of reasons. We do know that children and people don't get seriously ill. However, it may delay the rollout of the vaccination programme because you need to wait 28 days following COVID infection to have a vaccination if you're, and for the 12 to 15, that's just rolled out. So we just need to keep an eye on that, but working very closely with the vaccination programme, which now they now have what's called the Evergreen offer. You can get your vaccination if you're 11 to 15 anywhere, rather than previously it was just in schools. And we can see our vaccination rate is 77.8. That has changed slightly because that is for all 12 pluses, and we haven't quite gone through all the 12 pluses. So you'll see that has dipped down, but our denominator has changed a little bit on there. And obviously, some children are only allowed 1 dose, so it's a little bit confusing, but we're doing still very well on that front. And we've worked closely with the CCE to understand how people can get their doses and how, when they're invited, they can take that up. So hospitalizations fairly steady, a good low rate here. And so what we're not seeing now, as we saw in these other ways, with the really strong vaccination programme, it has broken that link between hospitalizations and cases, and that's really, really positive. And I think we need to really bear that in mind, that vaccination is a really key measure. However, it isn't preventing all hospitalizations, so the other measures of hands, face, space are still very important. And then finally, just to conclude, around deaths, we have a low number of deaths. We're still seeing some deaths from COVID, but it's actually quite a low number of deaths. Leader, I will stop there, but as always, very happy to take questions on the data, and then we can talk a little bit about other aspects of management of the pandemic, if that's helpful.
That's great. Thank you, Simon, for that quick run through. Who wants to speak first? Councillor Love? Councillor Love.
Thank you, Simon, for your report. Very much appreciate that response. Obviously, we've got half term that's just gone, and no doubt we'll be able to, I assume, measure that impact either as a fire break or as an increase to the situation fairly shortly. If you could just say roughly when that would be. But the other thing is, Simon, I just want to what extra resource do we need, if any, to focus in to support the schools at this time? So if we can get them some extra support. It seems to me that if that's where our COVID infections are, then we need to actually try and target some additional support there. Have you any thoughts about that?
Thanks, Councillor. Yeah, both really, really important questions. So on the targeting of to support schools, we have given them some extra money from our Contained Outbreak Management Fund to enable them to do that. They are, as you say, they're having a really difficult time in managing the pandemic and managing education at the same time. So we've done a lot of work there to support them. They are managing through our advice things like face coverings and distancing and bubbles to take that up. So that's really, really important, and that seems to be going well. We're doing more comms messages to colleagues as well through the schools. And sorry, just remind me of the first point. That slipped my mind as I was talking about that point.
Half term.
Oh, half term. Sorry. Yes, half term. Should,
so how will we measure that, and when we'll see the impacts of that, Simon?
Yeah, we should start to see the impacts in the next couple of days as the data comes out from that. We know it takes about 10 days for a change in policies and we saw a change in lockdown to implemented. So we should see any impact of the half term fairly soon. It is likely to be positive, a positive impact, because we know people are not mixing as much as they are in schools, but we will see that in the next few days.
Thank you, Simon, for that. I mean, is there anything specific that we can pick up from learning from other areas that is there anything specific that we can do? We just want to when we say about inputting, it's just that, which is very general, but if there's some piece of learning and something that we can do to give you some, support is a very general word, isn't it? But what specific support can we give? We need to know those specifics if there's something that we can do to help from a piece of learning elsewhere, or if we don't know the answer to that question at this point, if you wanted to come back to us, I think that's really important that we because it's just a general term of supporting schools, but how are we supporting schools? Well, this project, which Councillor Stevens has come up with, for instance, is going to be implemented. If there's something that we can do, let's know about it and try and do it.
Yeah, apologies. That's really helpful, Councillor Love. So for me, with the schools, we have been working nationally, because one of the things that has been challenging since the summer is the way that the contact tracing has worked in schools. It's not been as effective as it was, and we want to change that. And we have I've worked with central government yesterday to say, can you help us to implement that? We have a brilliant contact tracing service, but it's quite challenging in the school setting because of the age of the child. As you can imagine, if you're a child who's 9 years old, do the contact tracing, so work out who that child's been in contact with, has been challenging, but we are working through that with national colleagues to see what we can do there to improve that. We are encouraging schools where there is any outbreak to think about the measures they can put in place to do that. And myself, alongside all our direct public health colleagues, are looking at what should take place. There's nothing we're not doing on the Isle of Wight that others are doing, but we constantly have that question with other directors to see if there's any learning we can take, and please be assured if there's anything further we can do on the Isle of Wight, we will.
Okay, can I bring Councillor Ian Stevens and then Debbie Andre? Ian?
I'm gagged this morning, Simon. I've got my face mask on. I hope you can hear me. Anyway, straight to the point. Over 60s, there's an increase there of 12%, you said. That's the reported. What's the percentage, or what's the number, looking at hospitalisation of over 60s on the Isle of Wight at the moment? And can you give me some reassurance that we have the capacity, as we're only in the early part of November at this time, and knowing that we've got the winter to go, that have we got the capacity to deal with island elderly on the Isle of Wight? Thank you. And I'm talking about the present rate of infections that are reported. Thank you.
Thanks, Councillor Stevens. It's a really important point, and one of the measures that the government takes to ensure that the NHS doesn't get overwhelmed. And of course, that's a picture taken nationally, and we need to look at that locally, and we are. So the rates of hospitalisation, we don't get those by age, but we know that in the main, people going to hospital are those who are older, which is why we look at over 60s rates. And the hospitalisation rates are low and have come down recently. And I can share the exact figures. It looks like there's about 8 people currently roughly in hospital with COVID symptoms. So that's a small number. And the hospital pressures aren't just due to COVID, as you know, they're due to other things like standing up elective care and the backlog, and then other winter viruses. So we're working very, very closely with the NHS. It's a challenging area for them, but they are coping and working well, and we are keeping a close eye on that with them, and that'll be more for the NHS to respond to. But at this point in time, everything is on track, and we're working very closely with them to make sure that, from our perspective, the Health Local Outbreak Engagement Board, we do all we can to prevent spread of COVID and other infectious diseases, including taking of our vaccinations of both flu and COVID.
Yeah, thank you, Simon, and thank you, Councillor, for the question. I think the other important point that we know from talking to health colleagues is that a lot of activity at the hospital at the moment is from the kind of normal winter pressures that you would expect. It's just that they are being received a little bit earlier than might have been the case previously. So things like flu, rhinovirus, some children's infections, all the sort of things that were probably protected last year because we were all in lockdown and now starting to impact on the hospital. So I think there is a general plea, I think, that the hospital are working on in terms of messaging to, only encourage people to make best use of their GPs if they can before they start presenting at the hospital, because that's the best way of managing the whole thing through the process. And colleagues are talking to health on a daily basis about pressures in the system and how we can help manage those pressures in the system. But collectively, as a community, we can all help manage those pressures in the system as well by only presenting at the hospital if we really need to, or if we've been advised to, having called 111.
Okay, Councillor Andre.
Thank you, Leader, and thank you, Simon. You mentioned a cohort of 10 to 14-year-olds, which obviously transverses both the primary and the secondary sectors. Now, I know that at the moment, the government's guidance is for 12 years plus. I also heard today that in America, they have started vaccinating from 5 years old, giving them just 1 dose. So I'm assuming that we are, but also that and quite rightly so, I think, the government are waiting for that data to filter through before they make any further decisions. But it's interesting that you mentioned the sort of 10 to 12-year-olds. And So my question is, do we have the granular data for that? How granular is the data? Because obviously if we're vaccinating the 12-year-olds, it would be useful to know how that compares to sort of the infection rates in the 10 to 12-year-olds. But also, I think I'm right in saying that prior to half term, there were still 2 of our secondary schools that hadn't actually started the vaccination programme, and that is now underway. So hopefully that will have a delayed effect of kicking in. But also, as we know, it does also affect the transfer rate between the intergenerational transfer rate.
Councillor Andre, really helpful to pick that up. Yes, you're absolutely right. And what we have seen in the main was more cases in that secondary age, and that's just the age band it comes to. We do look at the breakdown, and it is made in that secondary age rather than the primary age. But you're right, the vaccination programme will be really helping that, because people won't be getting so ill, and they're then less likely to transfer the disease to others. And again, you're right that a couple of our secondary schools hadn't had that programme rolled out, whilst they're trying to do other school-based immunisation programmes. It's just a timing issue, and they are now, as you say, on track to have the vaccination. On the Isle of Wight, we are doing incredibly well in terms of the number of schools and the number of pupils being offered it, and our rate of uptake in that age group is higher than England, but we are doing more that we can do to ensure that as many people take up that offer in that age group that we'd like to. Bear in mind what I said about those who've got COVID have to wait 28 days before they can have their vaccination. So there'll be some people who aren't eligible just because they've had COVID recently, but it's certainly high on our agenda, and we're making sure that is picked up with colleagues locally.
Councillor Love.
One last quick one, and thank you, Simon, for all the work that you and your teams are really doing. We've really been through the mill over the last 18 months. Just need to just for clarity, we've got eight people in hospital. I'm asking how many of them were vaccinated. Do you have that information prior to going? Because I think that's quite important. And I think it's really great news that we're getting people vaccinated generally. But I kind of have a little bit of a concern about the 11th of November, in terms of, which I've been working on with the team around how many care staff we might or might not lose as a result of not being vaccinated. So the key message really is to get vaccinated. But can you just, of those people that are in hospital, which is better than the 18 that we talked about previously, in a previous meeting, how many of them were vaccinated?
Yes, thank you, Councillor Love. It's not something that we can know about the local people. It's not some information we have. What we know nationally, so taking from national information, that those in hospital in the main, not completely, are not fully vaccinated. So I don't know about the local picture, because that's not information, but that's the information we get from the national picture. So you're absolutely right. Vaccination is a key preventative measure to prevent hospitalisation and serious illness. And you're equally right that in terms of social care, a really important date coming up when social care staff need to be fully vaccinated to work, and that's a kind of workforce issue that I know that the Director of Adult Services and Housing Need is taking forward.
Thank you. And I just want to say that we are closely within adult social care looking at that very, very closely and monitoring the situation to try and assess what the impact might be right across all our independent sector as well as ourselves. We won't really know what's happening about that, but we do know that some of the care sector has adjusted its bed space and bed numbers in order to take account of their staffing needs, which means there's actually less bed space available for discharge, which is a bit of an issue, but still the 11th is still quite important. So I would be pushing and trying to give out a very positive media message, if I can, about care staff. Please go get vaccinated. We need you, we value you, we care for you, but the evidence is that vaccination overwhelmingly works, and we need to protect everybody in our care homes as everybody else. So this is not about us trying to force you to do something, but encouraging you to do something which will be important for your own health, but important for the lives of people that you care for.
Yeah, thank you, Councillor Love. And I understand the government are launching a new campaign today to encourage people to take a career in caring, and we've certainly been doing our own recruitment activity around that locally, and hope that people will follow that up. Sam, I just wanted to check a statistic with you if I can. I think the latest data is 16 patients in hospital with COVID. That's the latest published data. But I think I heard you say, I might have heard you say 8 or 6, but just to be clear, I think it's 16. And sorry, the second question is, are we, you may not know this, but are we still seeing the pattern that actually it's not, people are not always presenting with COVID. They may be presenting with something else, but on getting tested on arrival, they've been identified as having COVID.
Yeah, John, thank you very much. Apologies, I was reading off a graph. I expect your data is accurate in the sense there. So I was trying to look at a small graph. So John, if you've got that number, I will trust your information there. I think it's a bit of both. Some people are coming with COVID symptoms or symptoms that aren't quite so clear, and as you say, getting tested, and on admission, they are then found to be positive from COVID, but they're still counted as someone in hospital with COVID. Yes, that's correct.
Okay, I'm going to move on to the next item, which is update on communications activity. I'll bring Wendy in a second. Simon, I said to you yesterday in the meeting about a simple message. Just in the past 12 hours, I've got, this is what I've taken off of different posts on Facebook, I must admit, and it says, that's quite confusing. So I've got some people that are being said, just go to the chemist. You've got others that say, just turn up at the vaccine centres, they do walk-ins. You've got another message saying, wait for the doctors to contact you. You've got another one with the confusion over the double jabbing of the flu and the COVID. So there's a lot of confusion out there. When are we going to get a very clear message about what people should be doing for these boosters? Thank you.
Yeah, thanks, Leader. And I got an update last night from the NHS on what the current situation is. So I'll work with Wendy and colleagues to make sure that we can promote the right message about where to go, when you're invited, please turn up, and how to do that. So we will pick that up, and I was waiting for that information. So yes, absolutely, we've got to make that clear so that people understand what messages they can promote, and we need to give that clear message. So I'll hand over to Wendy, but absolutely we're working on that.
I would say people are being really responsible in wanting to have the booster and wanting to have their flu jabs, but it's just the confusion over the message. Wendy?
Thank you, Chair. I'll go through my update if that's okay with you, and perhaps we can pick up on that message as we go through. So one of the things that we've been doing over the last couple of weeks is setting out our strategy and approach to communications and engagement for the autumn and winter. One of the key actions of the COVID-19 government's framework for autumn and winter is to advise people on how to protect themselves and others, with an emphasis on clear guidance and communication. So that is certainly something that I think we locally can do and help colleagues in other sectors as well. Our approach will be to build and influence word of mouth COVID-19 engagement, and I think we've been very successful in doing that on the island throughout the COVID pandemic. The community has taken on board messages and has shared those messages themselves amongst various Facebook pages and social media pages, and I think that's a really positive thing that we're seeing, and is something it is a bit specific to the island. The community on the island has definitely reacted positively to doing what it can to keep people, families, friends safe. We're going to continue to use our localised methods of communication, so taking the national messages and localising them. And again, I'll give that emphasis on making sure they are clear guidance and communicated well. And we'll use all the channels available to us, and And we really want to kind of keep building those trusted relationships with residents. That's been really, really important throughout the pandemic. And I think we've changed our style in terms of the messages that we're giving to ensure that that's happening. Next week, we are going to specifically be looking to engage with people who may be going to the supermarkets. Our support officers are going to be actively kind of promoting, reminding people about the approach of taking a lateral flow test and the difference that that can make in finding out and confirming, you know, whether you may be asymptomatic or not, and how that can help prevent the spread of infection on the island. And I think that's really important, because what we've seen in the run up to the last half term is that kind of community transmission and how easily things can transmit throughout the community. So anything that we can do to put a break in, to put something in place that just breaks the chain of transmission in one little spot can be really important on the rate of cases that we have on the island and the further spread of COVID. Our emphasis will be on using facts and information, and sharing facts and information, and giving people the information that they need to make their own choices about what they do in response to COVID. It's about informed choices. People do still have a choice about vaccination, but we want to be sure that we share all of that information about why vaccination is a positive thing, and help people to understand if they have fears or if they have specific issues, to point them in the right direction of where they can find out information. Just recently, hopefully you will have seen that in support of the programme at the Riverside Centre, there was a specific professional expert on available to talk to people who were pregnant about whether or not the vaccine was the right thing for them, and to help allay fears. So that was something that happened over the last week, and we're hoping that that programme will be rolled out in further weeks as well, so that that advice can be ongoing. We also want to highlight the real experiences that islanders have had, so that we can keep that peer-to-peer sharing information. And our approach will directly tie in with the government's overall approach, but we really want to take that localised message. Objectives are around reminding people about how they can make good choices about safe behaviours, remind people about hands, face and space. Of course, that's not just important for COVID, but that's as important for all the sort of winter pressures and bugs that, you know, colds, flu, everything like that. Though the issues of keeping your hands clean, washing your hands, ventilation, open space, fresh air, just as important for helping people through general winter illnesses as well. We want to ensure that we keep giving out messages about when there are any changes in national guidance, and of course encouraging regular LFT testing and also PCR testing for those people who are symptomatic is part of our general approach. Targeting engagement, we've spoken about what we can do at schools, and I think we're also starting to put a programme together to what we can do at the school gate. So much like being at supermarkets and engaging with people, we can engage with parents at the school gate. And I think that's the parallel piece of work we can do to what schools can do internally for pupils. We can do something for parents at the school gate. And together, I think that gives us a more holistic approach to providing information. We do know that cases are currently high on the island, and they probably are higher than we would want to see. I think there is generally a sense of, and certainly anecdotal information that we're receiving from the testing centre, is that some people are resigned to the fact that COVID is still out there and it's spreading. I think people are weary of dealing with it. I think that's something we're battling now that obviously we weren't battling at the start of the pandemic. And in terms of taking ideas and strategy forward, we will be doing that through all of our channels, and we will be implementing that from now right through until after Christmas, and we'll obviously be putting together some specific messages around things like bonfire night in the run up to Christmas, staying safe in the new year, which will all be supplementing our general approach to communications and engagement. Thank you.
That's really good, Wendy. Thank you. You said we've got support officers. How many have we got? Because it's quite interesting about you putting them at the supermarkets. Friday's obviously the best day for that, because we know Friday's the busiest day for shopping, but also outside the schools. I think that's really useful to start getting around the schools. So how many do we have? Because I appreciate they can't be everywhere.
I think there are two things. We've got at least 4, but we can supplement that with some staff that we have on the ground in any case. The approach that we're taking is looking at parts of the island where case rates are higher as well. So not only are we targeting those types of locations, we're targeting areas, because we are trying to make sure that we get as much information in the right places so that we can help prevent the spread of infection on the island.
I'm impressed with that. I like targeting. Was it a Debbie, wasn't it?
Yes, just only on that point, just to obviously offer my support. I'm sure you'll tie in anyway, but I'm sure that there's sort of areas where we can work together on this. I mean, it's an interesting one, because the schools obviously have their own autonomy in a way as to how they've managed it. And I have to say, our schools have, I think, actually managed things extremely well, balancing up the risk and the way that sometimes they've made that choice, certainly as we were sort of coming out of the lockdowns, not to completely lift all the restrictions. So I think they've been fantastic how they've managed it. Presumably, the schools are going to be aware that, yes, okay, because obviously, you know, from all sorts of reasons, the schools actually need to be aware of what's happening outside the school gates. But no, I think it's fantastic work that you're doing.
Just to confirm for you, Councillor Andre, the team would work with the school heads and through the schools teams as well to ensure that whatever we did was done in partnership and people were aware that it was happening. They are not just going to turn up at the school gates.
Thank you so much for your report. I have to say that the comms team have been doing some pretty good stuff recently, and I really enjoyed listening to the Isle of Wight radio broadcast about recruitment recently, which is a deal between NHS and CCG and ourselves. And I saw the video, and I think that really was a very good quality piece of work that was done there by the comms team in getting the message out. It'd be interesting to see what the evaluation from that is at a stage down the line. But for me, there's just well, I've got 2 things that I just wanted to just try and pick up. I mean, yes, obviously Christmas. I think this is our last meeting before Christmas. Have we got one? We've got one in December. But obviously the pre-planning for Christmas, really important that we get some message, because people will be going out and partying and things. And I'm kind of interested, although I don't know the impact of this passport idea, which has been talked about in different parts of the country, you know, Wales and other parts, and because if we're now at a point where people are starting to struggle with the message because they've become weary, and we understand that weariness, we all experience that ourselves, then perhaps just a little bit more cajoling, enforcement, trying to support a message through a passport type system. I know we can't necessarily do that on the island without the legislation, but it would be really interesting, particularly for Simon and us, to look at what the impacts of that are, to see whether that's something that we need to champion and push forward to central government, because it's clear to me that once we get to Christmas that people will go out partying, and I'm kind of I think we need to preempt and pre-plan for what those impacts might be. I'm sure our health colleagues are, but still we need to push the message. And there are some, you know, particular points there. I mean, World AIDS Day is coming up, for instance. You know, I'm sure Simon's thinking about this. You know, it's another deadly virus, which unfortunately we're not in this wonderful position that we're in, where we can offer vaccination for that. You know, we need to be thinking about people who are most vulnerable from this virus, and that is people who have underlying health conditions and compromised immune systems. Whether there's something that we can push out there around World AIDS Day as part of that message for World AIDS Day, you know, another virus that we need to take note of, and selling our sexual health services, but also taking the opportunity to bring that together with COVID and to make the comparisons and what the learning has been from that. Because I don't think that we've kind of exploited that in terms of the message, not necessarily. So it's just the thought that I'm planting for you there. But I mean, I am kind of interested in this passport idea. I don't know if there's something that we can be doing with our nightclubs and our venues to try and encourage a safer application when people are entering into those spaces. It's not just the nightclubs, and it's the pubs and bars that will be busy. I can talk forever, you know that.
Simon, you wanted to come back to Councillor Love, and then I'm going to bring in Councillor Stevens.
Yeah, thank you, Councillor Love. Really helpful points around things like HIV. And yes, we'll work with our sexual health clinic. And what we know with the flu vaccination is that it's targeted at those with long-term conditions, and they're invited accordingly. So that we'll do the same for the COVID booster and those eligible. So we'll pick that up, but I'll certainly pick up with the sexual health clinics. I think you're right. There's an awful lot we can do in that space. COVID passports are quite complicated, and Plan B of the government's COVID plan, it would include COVID passports, so we will work to prepare for that should that be required.
Thank you. Councillor Stevens.
Thank you, Chair. The question for Wendy. You say we've got people going out and how can I say, spreading the word with regard to acting in a safe way and taking things forward. Cross-Solent travel is a big headache, and I've had reports from residents saying that once they get on that Cross-Solent ferry or craft, the number of people without face coverings, forget the social distancing, and the hand cleansing, but nobody seems to wear, or very few wear a face mask. Very few use hand cleansing, and social distancing. Really, it's okay. You've got a seat, and if someone sits next to you, or 3 or 4 sit round you, without masks and what have you, you're stuck. And I think that the adage is, or the instruction is, that if you're uncomfortable with that, then you can move or ask the staff of the vessel to remove you from that situation into another. Seems very, very sort of haphazard, and it's one of those things that whilst we on the Isle of Wight might do all we can and put out the best publicity and adhere to it, that the pinch points of people coming to the Isle of Wight from whatever area, without adhering to you know, the guidance, is going to cause us grief in the long term. And I'm just wondering how you, and how, if we have people that can be on the other side of the Solent as people get on, if we've got spare masks to offer, hand cleansing or whatever, working in conjunction with our cross-Solent providers, whether we could actually make that little bit of a difference, which might save 1 or 2 cases. And I'll tell you what, having had a couple of weeks of you know, being under the cosh, I can assure you that if we can at least alleviate some of the pressures for individuals, then I think that'd be most welcome, because people don't realise what it actually does. You know, and I've had 2 jabs and gone down with it, and it's been a long haul back. So I'm concerned about that. And if we've got a video, and if it's a good video, why don't we offer it to the cross-Solent transport provider so that it can be seen on there? And I'll just leave it at that. But I just feel that are we doing enough? And if you feel we are, that's fine. But if we're not, then we've got to step up the gear, especially with Christmas and the holiday season coming around the corner. Thank you.
I was just going to say that it does say on all of the craft, you know, please keep your masks on, please wear your masks. It comes over the tannoy, please wear your masks. People just ignore it, and there's no legal duty for them to do it because government hasn't forced that we have to wear them. So that is the issue. My thought is always protect yourself as much as you can. So if I've got a mask on, if I'm gelling my hands and I'm keeping myself spaced, I'm doing as much as I can. And it's sad that we can't. That people are sort of in a way, you know, that they don't think about the other people that are travelling. We've got cancer patients on those. We've got really vulnerable people travelling, and yet people are selfish. They ignore all of the signs and the notices. I'm going to bring in Wendy and then Carl.
Thank you, Chair. I mean, I think you've kind of summed up the situation nicely, which is we are an open country. We have no constraints placed upon us in terms of travel as we did during lockdown. And the government's policy is very much about personal responsibility for doing the right thing for yourself and your friends and your family and making good choices in that way. And Councillor Stevens, you said so yourself, what we have is guidance. It's not regulation. And so all we can do is encourage people to behave in the right way. Just a couple of points. In the run up to half term, and we're planning for Christmas, February half term and Easter, we're working with travel ambassadors so that they will be actively either in the ports on the mainland or on board, helping people understand about, well, we have the message, don't we, travel the white way. You know, we'll look after you if you come to the Isle of Wight. Look after us by doing the right thing when you come here. Think about, you know, what you're bringing with you in terms of masks. Think about social distancing. Think about taking care of the island just generally when you're here. But so that message is still ongoing. That message is part of what's shared on board for each of the operators. As the Chair says, they do give out the messages, but the operators themselves very much have their hands tied because they have no way of enforcing that. We can still work very proactively with Visit Isle of Wight and the operators to make sure that wherever possible we're giving those messages out, and that, you know, that's a passion of mine, and I do that regularly. And the team provide to the operators and Visit Isle of Wight lots of information and advice that they can also share. But as ever, if there's anything else we can do or anyone has an idea, then we're more than willing to listen to those ideas and move them forward as well.
Can I just say, Wendy, I think, you know, travel ambassadors around the Christmas period, when I know those boats are absolutely rammed, bearing in mind they've got reduced services, you can now not book a ferry, I don't think, in or out for around the Christmas period. They are all fully booked. I don't know about Whitelink, but certainly Red Funnel, I think we have one of the last 2 spaces to pick up our daughter. Carl and then Debbie, and then we're moving on.
Thank you, Wendy. And again, I think that's a super idea that you've come up with about us creating a specific video, particularly for around Christmas and on offering. Of course, that would have to be, you'd have to do some negotiations there, accept that. But offering that video out as a really comprehensive, you know, the Father Christmas with his mask on and blah, blah, blah. And the travel ambassadors being out there actually perhaps dressed up in gowns and things to say, hey, this is our Christmas gown message so that it's physically seen. I think you're absolutely right. This apathy is there. I've travelled on the ferries and I feel quite it's a difficult situation for the ferry operators, I accept that, but I don't think that the message is being pushed enough by them, and they could do more, but we can help them do more by providing the solutions which we've just talked about here, which I think is really important, because you do see lots of people walking around who are kind of have become, you know, hardened to the message, haven't they? You know, and that's really difficult. And the ferries are, and I've always believed, the flashpoints. So the more that we can do to support our ferry operators, and perhaps during the next meetings that you're having with the local, you know, transportation board, is that could come up. And also on our new trains as well. That's another, you know, and the bus services. Let's face it. So if there's something that we could do there, even if it's kind of maybe funding them all to have a super duper Santa outfit with masks and whatever, it delivers a message, doesn't it?
Can I bring you Councillor Debbie Andre?
Just because you're cold.
Just following on from what Councillor Love was saying, I was actually on Red Funnel coming back on the Friday night at the start of half term from the mainland. I was the only person wearing a mask, and the ferry was absolutely rammed. I know that, Wendy, we have produced some excellent posters, and I'm wondering if perhaps that would I think there needs to be better visibility of the island message if the ferry operators were willing, even because you have, I mean, on both ferries, you have the flights of stairs that you come up. And I know that there may be a cost involved in this, but if we could actually have the island message as people are coming up the stairs, it might actually filter through.
Yeah.
The other thing, Chair, is no. Cool. You know, I can talk forever. That's what I'm good at. Yeah. Well, I was just going to say, tiny little. The other thing is that I run a B&B, and I absolutely insist that my visitors have all been vaccinated before they come to my B&B. There's something in that which we could actually try to, I mean, that doesn't take account of everybody, I accept that, but there's no way that anybody's coming into my B&B that has not been vaccinated, because I'm protecting me, my health issues, and anybody else that comes in. I think there's an important thing there that we could perhaps work with the Chamber of Commerce around seeing if we can get them to take on that kind of message. If you come into the island, you know, your establishments that you're going to will expect you to be vaccinated. I think it's a reasonable message.
That, you know, I'm glad I allowed you to make that point, Councillor Love, and thank you for being very responsible. I like that. John.
Thank you, Chairman. I did just want to make a point on the face coverings and the vaccine passports, because I think we've talked about the government's Plan B, and actually that's exactly what Plan B is. It's reintroducing mandatory wearing of face coverings and mandating vaccine passports in pubs, clubs, wherever they choose to do it. And I think at the moment their strategy is, if you threaten that enough, then people's behaviour will be sufficient to change and therefore not want to do that, so they'll do that voluntarily. I think there will come a tipping point where actually that hasn't happened, so we may get to the situation that you're both describing, councillors, in the sense of saying people are going to have to go back to wearing face coverings on public transport, face coverings in shops, and that's, I think, the government's strong message, and the message that we're trying to give out here is let's behave sensibly, let's behave properly, let's behave proportionally. Take some of your words, Councillor Love, and then we won't get into that situation. There is a possibility that the government might not introduce it across the whole country. They might introduce it in high risk areas. And that might be where we might want to take a pitch or make a pitch to government if they allow us to do that. But at the moment, that option is not open to us.
Can we offer to test it? Because we're the perfect place to test it, aren't we? I know we did have this testing business before, but would we not be the ideal place to try and test that passport system? Is that not something you could champion to government?
If I'm honest, Councillor Love, I think that's pretty much what the lockdown did, tested it quite thoroughly, so I think they know pretty well how it's going to work. So, but as I say, I think that with your support as a local outbreak engagement board, if the government offered that particular opportunity, I'm sure we'd want to have a conversation, depending on what our case rates look like. But enforcement is always going to be the problem of those issues.
And I would say if we are going to do some kind of little video clip to encourage people, I'd forget Father Christmas with a mask and that sort of thing. What I would do is show two types of Christmases, and it's those Christmases that this year people have lost. I can't even speak, but people have lost family, and you see the difference between those two Christmases and what they're going through this year and what they're going to. And it's about the protection, sorry. That's true, they're going to have a miserable Christmas. Some people
Thank you. Thank you, Chairman. Chairman, we've come to item 5, which is members' questions. No questions have been notified. I don't know if any members of the committee have got questions. I think we've done to desk everything we can, so I'll call the meeting to a close, and we meet again on the 3rd of December, I think it is. Thank you.
Not to do with the meeting, but tomorrow is the LGA Awards for